Why are lymph nodes important in colon cancer staging? Imagine your body as a busy city with roads and checkpoints. Lymph nodes are like small checkpoints along the lymphatic system, helping to filter out harmful substances. In colon cancer, these checkpoints become very important because they tell us how far the cancer has spread. When doctors examine these lymph nodes, they look for cancer cells that may have traveled from the primary tumor in the colon. Finding cancer in these nodes means the disease has spread beyond the original site, which influences how doctors plan treatment and predict outcomes. In colon cancer staging, the involvement of lymph nodes is a key factor. The staging system used is called the TNM system, where the letter N stands for lymph node involvement. The number of lymph nodes that contain cancer cells helps determine the end stage. If no cancer is found in the lymph nodes, the cancer is considered node negative, and patients tend to have a better chance of survival. If cancer is present in the lymph nodes, it is called node positive, and this usually indicates a more advanced stage. The more lymph nodes affected, the worse the prognosis tends to be because it shows the cancer has spread further. Lymph node status also guides treatment decisions. For example, if cancer has spread to the lymph nodes, doctors often recommend additional treatment called chemotherapy after surgery. This helps reduce the risk of the cancer coming back and can improve survival chances. To make sure staging is accurate, pathologists usually examine at least 12 lymph nodes during surgery. Examining enough nodes helps prevent understaging, which could lead to missing cancer spread and not giving patients the right treatment. Beyond just counting positive lymph nodes, other factors related to lymph nodes can influence prognosis. The ratio of positive nodes to total nodes examined, called the lymph node ratio, can give a more precise picture of how advanced the disease is. Sometimes, cancer deposits found near lymph nodes, but not inside them, are also important because they can indicate a worse outlook. Additionally, if cancer spreads beyond the capsule of a lymph node, known as extranodal extension, it is associated with a poorer prognosis. The location of the affected lymph nodes can also matter. For instance, nodes near the main blood vessels supplying the colon, called apical lymph nodes, might provide additional information about the disease's spread. However, the number of positive nodes remains the most critical factor in staging and prognosis. In summary, lymph nodes are vital in colon cancer because they reveal whether the cancer has spread beyond the primary tumor. Their involvement helps determine the stage of the disease, guides treatment choices, and predicts survival chances. Accurate assessment of lymph node status ensures patients receive the most appropriate care. If you or someone you know is dealing with colon cancer, always consult healthcare professionals for personalized advice and treatment options.